Hi, my name's Dr. Catherine Bacus and I'm from Allevia Medical Weight Loss. Today we wanted to talk a little bit about when not being okay is a bit more than not being okay. In other words, sometimes we can feel overwhelmed, stressed, having difficulties with our normal day-to-day, just feeling a bit flat and blah. And sometimes that develops into something a little more. So some symptoms and signs of depression are when you are persistently feeling low, difficulty getting out of bed and feelings of lack of motivation, not finding any joy in the things that you're doing. You might find yourself feeling more irritable, angry, snappy, have difficulty sleeping. You might be eating more than normal due to stress, and some people go the opposite and eat less. If you're feeling more anxious, there's this persistent feelings of fear and worry and sometimes tremors or just difficulty getting to sleep once again. So if you are experiencing, if you know that you've already got depression or you've suspected it, or similar with anxiety, you may already have reached out to your GP and have a treatment plan. That could be, use of medication. It could be having a psychologist on your team to support you during this time. Please reach out to your GP and discuss that with them, because sometimes those little things need tweaking to be able to help you to feel the best that you can, whether it's an adjustment to your medication dose or whether it's just re-engaging with a psychologist because you might have been coping really well up until now and now things are just getting a little bit harder. For other people, they've experienced depression or anxiety for the first time, and this can be really disconcerting because we sometimes have a sense that, we should be able to cope with these things, that there's always someone else out there who's, a bit worse off than us, so why should we feel this way? Or it can just be sometimes a little bit of a shame or, stigma around reaching out for assistance in this area. Don't be that person. I just want you to know that, we are here to help. You don't need to suffer in silence. You don't need to try and get through this on your own. You have a team of doctors at Allevia to assist you. You've probably got your regular GP as well that you can reach out to. We're here to support you, okay? So just some red flags to look out for. If you are feeling quite overwhelmed to the point where it's impacting on your work, or it's impacting on your relationships where perhaps you're not able to be present to your kids as much as you'd like to, and let's face it, we're not perfect in that area, but it's having more of a severe impact on their care and well-being, or if it's impacting on your physical health, if you feel as though your sleep's been really severely impacted, or you're just struggling to get out of bed, or the worry is just overwhelming and keeping up at night. That's some times that you'll need to be really diligent about reaching out to your GP. Or if feelings have become so overwhelming that you feel as though it's not worth going on, or you've had thoughts about self-harm or suicide, then that's crucial that you talk to someone about that. In the section below, we'll give you some resources as well, and people that you can reach out to. Lifeline, of course, Beyond Blue, Black Dog Institute, Sane, ourselves, your regular GP. There's an abundance of support out there, so please make the most of it. Self-care, I think, is all about routines, making sure that when we're feeling depression or anxiety, scheduling your day to have some kind of routine is really crucial. So that might mean that you set maybe some 3 or so activities to get done for the day. One of them might be about something to do, so we can have a sense of achievement. So it might be, if I'm out of work, I might put together my resume or work on my resume for the day. Might be a little bit over the week. If we've got a job that we're currently fulfilling, it might be that we fulfill a task at that workplace. Sometimes it might just be having a shower, that's the biggest task that you can manage for the day, and it's just important to get that a sense of achievement. Also around self-care, so I guess that's where that other task might come in. You want to make sure that you are doing things for your own self-care, health and well-being. So it might be that you prepare a really nice meal for yourself at lunchtime. So you sit down and you look at the vital foods that you can prepare. It might be a salad or a soup or some meat and some vegetables of some description, and you sit down and you eat that food mindfully as a gift to self. And we've talked in previous sessions around the importance of sleep and routines as well, but also it might be scheduling in some social connection as well. So it's very easy to become more withdrawn when we're depressed, but making sure that we are reaching out to friends and family around us, all through our support group as well. That's always there for you to access too. So depression and anxiety might be exacerbated if you've already got pre-existing depression or anxiety, or you might find that you're experiencing those for the first time. In any case, please reach out to us. We are here to help, and we'll be posting some resources in the comments section below to assist you as well. Thanks for your time.